At Global Health Partnerships, 40% of our diabetes patients struggle with consistent glucose monitoring, and 25% need emergency room care for unmanaged complications. These aren't just numbers. Our patients face daily challenges managing their medical conditions. We care for patients with unique needs, different languages, and capabilities. In this presentation, I will show you how implementing Cognitopia's self-coaching technology can improve these numbers and save money through preventative care, improving patient outcomes and safety. Cognitopia is a cloud-based application that utilizes the latest in user-facing technology and adaptive and personalized learning. Our goal is to ensure inclusive and equitable learning for all patients, no matter their capability. Cognitopia is an easy-to-use teaching, coaching, monitoring, and scheduling tool that GHP can customize to meet our initiatives. Although it can be adapted and used in many environments, I see Cognitopia initially used in the diabetes care unit. The patient slide represents an intuitive control panel where patients enter glucose readings, log meals, and track medications. This information is instantly processed and displayed through easy-to-understand, real-time dashboards. Cognitopia shows patients their progress toward wellness goals and alerts them when action is needed. Healthcare providers see this same information in real time on their computers or devices. However, their more complex displays highlight trends and identify potential concerns. It's like having continuous vital signs monitors for day-to-day diabetes management. Like all medical providers, we face challenges every day. GHP currently has over 2,500 diabetes patients. All patient satisfaction surveys show that the staff is diligent and caring. They're doing a great job. The problem is when the patient goes home after the medical visit. What happens? In addition to the glucose monitoring and ER visits, 33% miss appointments. 45% have difficulty following dietary guidelines, and 30% are challenged to take their medications as prescribed. The business value of a tool like Cognitopia could help with two core values. Number one, excellence in patient care by focusing on preventative medicine and innovation in healthcare solutions. Now let's examine a what-if scenario and a future user experience. Esther is a diabetes patient. She was selected for the Cognitopia program because she's actively engaged with her smartphone, loves watching videos, and playing games. With the universal design, alternative formats, and appointment reminder feature, Esther is thriving. She has Cognitopia and can monitor and own her behavior. She no longer misses appointments, and she feels empowered. Now let's look at the pros and cons. We anticipate better learning outcomes and better educated patients. We can see the organizational benefits of reduced costs and better patient outcomes. On the other hand, there are potential challenges with technology interdependencies. The IT staff needs to look at supporting technology to integrate a tool like Cognitopia with the electronic medical record system. They must examine the risk management factors and determine what happens if a system fails. On the clinical side, we need to ask questions like how many patients can access the internet? How many people are challenged because they don't own a smart device? Or how does the care staff react when they suspect the information patients enter is inaccurate? For patient safety, the question is, what protocols can be set to handle these situations before they become emergencies? Let's look ahead and ask another what-if question again. After the IT review and their go-ahead for the pilot program, let's say we are prepared First, we must define success and examine objective metrics, plus our current data, to show the potential return on investment. To prepare for the pilot study, we choose 100 patients who currently use devices like smartphones and tablets and have been diagnosed with either type 1 or type 2 diabetes. We train staff members and patients. We gather baseline metrics. In phase 1, we begin the program, and in phase 2, we do a 30-day review. In phase 3, we complete a review after 90 days, looking at all of our data and evaluating the results. To summarize, we must look at the impact of Cognitopia to supplement the care provider. Cognitopia does not replace staff members, it gives them the data to do their jobs efficiently. Constant monitoring, integrated with electronic medical records, helps the care team be more effective with limited resources. What we learn about supporting, motivating, and empowering our patients could transfer to other care units. Those units include the maternity department to manage gestational diabetes, reduce hospital stays in general. As GHP examines emerging technologies, we must understand the technology. Then we must anticipate how the emerging technologies will become integrated into the care environment for efficiency and effectiveness. We all share the organizational vision of equity and inclusion in healthcare. The key is helping empower people to control their health by making better choices. The bottom line is Cognitopia could solve our problems.